Welcome to the Hope for Healing Network. This is Cecily Henderson. Thank you so much for joining us in this safe space today. I have a very honored guest on. I've interviewed him a few times. Every time I interview this very special person, I learn so much from him. So, Dr. Khan, thank you so much for being willing to come on, talk about breast implant illness, and share of your expertise with us.
It's a pleasure to be on and to basically do another live with you. You were here in person at the surgery center and in my clinic, and it was a pleasure to meet you. You truly have this quest and goal to spread awareness, and I couldn't be happier basically spreading the message. And again, as you will see, none of what I am going to say today is my opinion. These are hard facts, and I want the patients and their significant others and whoever it may be it the primary care doctors or the plastic surgeons, to approach this with an open mind and non-biased. And as you will see, there is clear evidence of the potential harm that both saline and silicone implants cause.
Yeah, thank you, Dr. Khan. And this is why I wanted you to come and speak, because you are talking about facts. And a lot of people, or some people in this group, have never heard of breast implant illness. They don't understand it, but they know somebody with breast implants or have somebody in their family or themselves that they have breast implants and are wondering, is this the cause of my symptoms? Is this the cause of why I'm so sick? So I appreciate you talking about it, because some people do not believe or do not understand breast implant illness, and it is a very serious illness. And if you wouldn't mind sharing what you experience every day today with your patients and what you see as far as breast implant illness, and then also the recovery after you take out their implants.
Yes, so very good. Now, today, for example, just today, this was a few hours ago, I had a patient of mine. She came from San Francisco, California. She's a 68-year-old lady. I actually did a Facebook Live. So for those patients, please join my private breast implant illness support group page by Dr. Khan, and you will see this with your own eyes right before your eyes on the Facebook page as Facebook Live. Sometimes I do a YouTube Live, and you will see these images right before declaring what the patients are going through. So this patient, 68 years of age, she had her implants done in 1982, silicone implants. So just the fact alone, she had implants from 82, we know with absolute confidence, and I said this in my Facebook Live, 99.999% that they are ruptured. And indeed, both of them were ruptured. Now, this is where eventually all implants will potentially be either replaced or removed, because let's go ahead and look at this first warning. Now, remember, this is the Mentor advertisement, as you will see, a Mentor. And I'm going to read verbatim. So these are not my words. These are the words of the manufacturer and also the FDA. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. So just right off the bat, they last anywhere from 10 to 15 years before they eventually rupture. Now, remember, let's go ahead and look again. And I'm going to continue to keep reading. MRI screenings are recommended 3 years after initial implant surgery, and then every 2 years after, to detect silent rupture. Silent rupture means that the patient has a known rupture, but if you examine her, there are no suggestions of what is a rupture. So remember, the best exam, if you have a group of 100 plastic surgeons who examine this patient, they will not be able to tell if the implant is ruptured or not. There are many patients that I have taken care of who had ruptured implants, and when I examined them, their exam was normal. It was unremarkable. The patient had no pain. And so she had what was a silent rupture, and majority of the ruptures are silent. And lo and behold, we go inside the operating room, I do the case, and I find out that the implant was ruptured, to my surprise and to the patient's surprise. So the point here is these are not lifetime devices. So this patient Technically, officially, if you ask me, should have had, if she had implants for 42 years from 1982 to 2024, at least 20 MRIs, correct? Now this is she really going to have gotten, would she have gotten those MRIs? No, the insurance is not going to cover. And this is where, unfortunately, look at my, so once I did my case, I saw my patient in clinic. She's going to have her surgery tomorrow morning. And she has history of right breast cancer with radiation and a big latissimus flap to cover her chest. She is 64. And lo and behold, she had an MRI done, and she had what is an 800cc implant on the left, 650 on the right, and she has a known ruptured left breast implant. Now, look at her. She has already gone through the breast cancer phase and the radiation, and 9 out of her 12 lymph nodes were positive. And now at 64, she has to now deal with what is a explant, removal of eloderm. She had 2 eloderms placed, which is cadaveric skin, and she has to deal with the left 800cc breast implant rupture at age 64. And remember, eventually, sooner or later, the implants will potentially rupture, right? Because they're telling you, right? I mean,
Yeah.
this is not a secret. So those times where you have heard where the plastic surgeon said that these implants will be with you forever for the rest of your life, this is wrong and an error and misinformation. And this is wishful thinking. This is wrong information. Now, this is a lady, she's going to have what is extensive surgery on her chest. Remember, given the history of radiation, it puts her at added risk for like wound problems, among others, because remember, radiated skin, she has also had a latissimus flap, which is the muscle from the back was brought in the front in order to reconstruct her to give the blood supply. And the point I'm trying to make here is that the longer people have them, the higher the chance of problems, some of which will require more surgery. Again, these are not my words. These are the words of the mentor itself. Now, let's go back to, you said something very important, breast implant illness. Some patients do not agree that breast implant illness even exists. There are many plastic surgeons who say breast implant illness does not exist. And guess what? Not my words. These are the words of the manufacturer mentor. And this is, remember, the FDA warning.
And we're going to put the black box warning up on in the comments, as well as your group. So if women want to join, but yeah, we're going to put that right up in the comments for people to look at.
Yes, very good. Now, patients, so quote, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Close quotes. Now, this is breast implant illness, right? So the manufacturer is telling you the joint pain, confusion, muscle aches, chronic fatigue, autoimmune diseases. Now, remember, this is a blanket of problems, right? Now, this is, let's keep reading. Quote, individual patient risk for developing these symptoms has not been well established, period. Some patients report complete resolution of symptoms when the implants are removed without replacement. Close quote. So they're saying you're going to have complete resolution of symptoms. Now, this is where, if you ask the 1,000 ladies that have explanted, or the 2,000, if you will, and you ask them, what is it? What are those symptoms? So in my practice, as you know very well, I have my patients fill out this questionnaire. Now, basically, what is breast implant illness? It is a constellation of signs and symptoms that the patients experience as a result of silicone toxicity, be it the saline implant or the silicone implant or the ruptured silicone implant. Now, the saline implant is certainly not safe because the same set of problems that the patients tick off over here with intact saline implants, patients with intact silicone implants and ruptured implants present with the same set of problems. Some patients may check off 2-3 boxes. Some patients will check off every box. And what are these boxes? They are a constellation of symptoms that affect every single organ system of the body. And from head down, from the hair loss, hair follicles being affected, migraine, headaches, skin texture changes, teenage acne formation, if you will, dryness of the eyes, which is the Sjogren syndrome, olfactory changes where your taste changes, neck and back problems. You have problems with vertigo, tinnitus, ringing in the ears, throat trickle. You have basically some patients report like TMJ signs, symptoms because of the inflammation, thyroid problems, breathing, difficulty breathing, dyspnea on exertion, which means when you exert, you have difficulty breathing before you could work out actively, neck, back problems, the fibromyalgia type symptoms. The rheumatological joint problems are the major hallmark features of what is breast implant illness. And then you have GI disturbances. Many people have aversion to food. They cannot tolerate food that they could tolerate before. You have patients with endocrine reproductive problems, miscarriage, for example. This has been reported. Stillbirths, for example, have been reported in the literature. Patients with premature menopause. You have patients with plantar fasciitis. Again, interstitial cystitis, which is bladder problems, increased UTIs, amongst the many others. So this is where I give this questionnaire to the patients, and they will check off chronic fatigue, which is by far the most common problem that the patients have. Cognitive dysfunction, which means brain fog, difficulty concentrating, muscle aches, weakness, joint pain, soreness, hair loss, dry skin, eyes, mouth, hair, weight gain or weight loss. In some patients, maybe 1 out of 10, they will have weight loss. Easy bruising, slow healing, temperature intolerance, low libido, autoimmune problems, Graves' disease, Raynaud's phenomenon, night sweat, skin rashes, insomnia, estrogen progesterone imbalance, swollen tender lymph nodes in the breast area, tingling, numbness in the arms and legs, very common. Patients have gone to the neurologist. They have had EMGs all normal, but they're complaining of this tingling, numbness. Not all. Remember, some patients may check off 5, 10, some 20, 25. Tingling, numbness in the arms and legs, burning around the chest and breast. You can have a contraction, as you will see, we'll talk about cold, discolored hands and feet, foul body odor, also common, muscle twitching, vertigo, dehydration, frequent urination, chronic neck and back pain, photosensitivity, nail changes, rashes, swelling around the eyes. If you go on Google and type in breast implant illness before and after explant, you will see the patient's own faces and the edema swelling around the eyes, the before after pictures, sometimes even hours after the surgery, you will see the dramatic improvement in their face profile. You have thyroid, adrenal problems, decline, changes in vision. Many patients, as you will see, they will report that they will have altered vision and the dryness of the eyes. Sometimes they will have irritation of the eye. Sometimes they will have glasses that they will have to wear. Post-operatively, they will see, and these are their own words, not my words, that they can see high definition. Their dryness of the eyes improve. Slow muscle recovery after activity, gastrointestinal digestive issues, food intolerances, chemical sensitivities, patients that have severe reaction to, let's say, Clorox, bleach, or perfumes before they could tolerate, or they're very sensitive to the smells. Persistent infections like viral, bacterial, suicidal ideation, believe it or not. Not that common, but it does occur. Shortness of breath, heart palpitations. Believe it or not, a lot of young ladies with heart palpitations, they have gone to the cardiologist, they have worn the Holter monitor, they have done echoes, and everything points towards a normal heart exam, but they complain of this. And there is improvement reported by the same ladies post-operatively. Thrush, diagnosis or symptoms of fibromyalgia, feeling like you're dying, chronic inflammation, recurring sinus, yeast, UTI infections, throat clearing, very common as well, difficulty swallowing, choking feeling, headaches, dizziness, migraines, a lot of anxiety, panic attacks, mood swings, emotional instability, metallic taste in the mouth, symptoms or diagnosis of Lyme or ringing in the ears. Now remember, these are the 14 organ systems from the head to toe, all different organ systems. In some patients, not at all. One patient came to me and she said, I have 0 symptoms. And I did a Facebook Live, and believe it or not, that patient ended up having a ruptured implant and she had no symptoms. Some patients, young, they have a lot of symptoms. Some patients just 5, 10 checked off. And the point here is, When the patients come to me, I do an in-depth exam and physical exam. Now, sometimes I hear directly from the patient if they're doing a phone consult or their primary doctor does an exam, and I can definitely pick up quite a lot on that. Now, even if I have examined someone, I cannot tell them that you have BII or you do not have breast implant illness. It is a diagnosis of exclusion. So I tell my patients, have you gone to the doctor? Have you had Hashimoto's ruled out? Have you had like a kidney problem with like scarring of the urethral valves, for example, that may cause UTIs, for example, or you have other problems that may account for your problems. Now, a patient has normal EMG, like I said, normal cardiac exam, like a normal Holter monitor or echo or normal stress test. They have tried everything. Now, more and more fingers point towards what is breast implant illness. Because remember, it is a pattern recognition of problems. Young lady in her 30s, brain fog, fatigue, joint pain. She slept 8-10 hours and wants to sleep another 4 hours, and her iron levels are normal. She's not anemic. She has normal thyroid levels. Now more and more fingers are pointing towards what is breast implant illness. And this is essentially, and I never promise my patients, I never tell them, this is where you cannot go in and say, well, the end block is, not required on everyone. You never know if the implant is ruptured or not. So you have to always assume it is ruptured till proven otherwise, because you don't want to be, as a surgeon, caught off guard and the next thing you know, you have a ruptured implant. So this one lady, the second lady that I just saw in clinic, she has the MRI proven rupture of a 800cc implant. She had the breast cancer on the right and prophylactic left breast reconstruction with alloderm and an implant. She's just 10 years out from her reconstruction. Very unusual, but it does happen. She has a ruptured implant. So I'm going to go in now. Luckily, she has had an MRI, but I'm going to go in just like I did and I do in all my patients, assuming that all breast implants are ruptured till proven otherwise, because I don't want to find out otherwise on the table. So to answer your question, breast implant illness absolutely 110% exists, because we just read it. And these are the symptoms that the patients come in with, and these are their own subjective findings. And you will see that many patients who, in thousands and hundreds of thousands, and I will say millions, who have come forth and said that the implants cause them harm. This is between the 1992 ban and the many ladies who have explanted and who continue to explant on a daily basis, not only in the United States, but across the world.
Wow. As you were reading, thank you so much for sharing that information. Because as you are reading, going down the list of all the symptoms, and I remember checking every box. I had every symptom that was on that list, and being told that nothing was wrong with me. And I think a lot of women feel alone because they're being told all their test results are normal, their blood tests are normal, and that nothing's wrong. Go see a psychologist. It's psychosomatic, and it's very frustrating. And you are one of the advocates that are actually standing up for women and for women's health. And I just appreciate you doing that, because nobody's speaking up for these women. Not many people are. There's people such as yourself, but women feel so alone. So what can they do? Like if women feel like they have these symptoms, that something might be wrong with their breast implants, what's the first step for them?
So the first thing is go to your primary care doctor and talk to them about your problems, about your checklist. These are the complaints that you have. Remember, very basic, very subjective, and you will clearly know if you have a GI disturbance or not. You will clearly know if you're having migraines, anxiety, panic attacks, for example. If you're having dryness of the eyes. Now, these are real complaints, because, just like you and I are talking and I have a complaint, I will bring it forth to my doctor. Now, the other thing I want to emphasize is, if I start seeing patients with chest pain or heart problems, I'm going to say I know zero. And I'm not a cardiologist. To be quite frank, I cannot read an EKG, and I'm happy to state that. Now, if I see someone with chest pain, I'm going to go see the cardiologist, because that's not my area. So likewise, if someone comes to me and says, I have Hashimoto's, I have rheumatological problems, like I have rheumatoid, I'm going to say, I have no idea. Or a kid comes to me who's 7 and says, can you take care of me? I have an illness. I am going to say, I am not a pediatrician. Same thing with the primary care doctors. When they say that this is all in your head and you are normal and your results are normal and your exam is normal, I'm going to say to that doc very nicely and professionally, have you even touched a breast implant in your life? And the answer is going to be no, because not many medical students rotate through plastic surgery unless they have a plastic surgery friend. And the point I'm trying to make is they cannot weigh in and say that this is artificial, this is made up, correct? So you have to go to see someone. Now, in the vast majority of the plastic surgeons who say, well, breast implant illness doesn't even exist, I will say either they are right or this is right. And I'll tell you, this is not wrong. This is correct because this has been proven and it's proven every single day. And the point here is that there is, look over here, some patients report complete resolution of symptoms, meaning this is a cure, right? I mean, they're telling you it's a cure. And these are not my words. I
Exactly.
didn't type this up. You can see this. Anything and whatever I have said is not exaggerated. This is as a patient who
So
has had an augmentation should not be coming to you as a surprise because this is the black box warning. Your plastic surgeon must have, should have, is required to discuss all of this with you. So you should say, well, I know that because my plastic surgeon told me that they're not lifetime devices. Your plastic surgeon should have also said breast implants have been associated with the development of a cancer of the immune system called breast implant associated anaplastic large cell lymphoma, BIALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, which basically means smooth implants do cause, but it's relatively much less common. Although rates are not well defined, some patients have died from BIALCL. Now, remember, this is also your plastic surgeon must and should have, is required to by law to discuss, and this is part of the informed consent, so that you as a consumer must know that this exists. Now, if someone asks me, if I may, what are the detrimental or the bad things associated with breast implants, I will say, well, that the signs, symptoms of breast implant illness, right? Not everyone. Remember, I said not everyone. Number 2, the BILCL. Number 3, they're not lifetime devices. You need to get them monitored. We talk about the MRI, right, in the silicone. Number 4, capsular contracture, where this hardness of that capsule occurs and it compresses the chest. And it can be as high as grade 4, where you have pain along with a distortion of the chest and breast tissue as a result of the deformity that's also visible and palpable. You can get infection. You can get acute and chronic pain. You can get rupture. You can get other cancers like BIA-SCC, breast implant associated squamous cell cancer. Now, remember, that is very rare. And to date, approximately 16 cases have been reported. But the problem now that we're dealing with, and this is well recognized by the plastic surgery societies, by the FDA, not everyone is fixated into removing the capsule. Even if they remove that capsule or part of the capsule, they're not sending it off to pathology. Even if they're sending that capsule off to pathology, they're not doing a CD30 test. And this is why a lot of this is being missed. And so this is where the capsule must be removed. Now, I will tell you, does it have to be removed in everyone? Not necessarily, but the point here is, how do you know which capsule is bad, which one is ruptured, which one should be end blocked, which should be, no one knows, right? And we will talk
exactly.
about this in a little. So bottom line here is, what if I am the patient, what do I want? I want 2 things. So that patient from California who came today, and remember, California is full of plastic surgeons, right? She did her homework. She sought me out. She and I talked. There's that complete determination about what is the goal of the surgery. Number 1, remove the entire implant, capsule, all inflamed tissue. In her case, very high likelihood that it was ruptured. And remember, majority of the times we do not know if it was ruptured or not. So all of that implant capsule and inflamed tissue is removed in that end block fashion. where there is no break in the capsule. And if there is a ruptured implant, it's all contained and such that none of the silicone spills into the chest. And all inflamed tissue and capsule and implant is removed as one system. And number two, that it is checked for the lymphoma, the very rare lymphoma. It's very rare. To date, almost 1,500 or so cases have been reported. But remember, these are very much underreported. And that cultures are done for bacteria and fungus, and that the patients have the peace of mind that there's no breast cancer or anything associated with the implant or that capsule. And that is the whole goal and essence of the surgery.
Wow. That is a lot of information. And women that are having problems with or feel like they're having problems with their breast implants, I appreciate you bringing up that point, because they need to understand it's not just finding a surgeon, it's finding a surgeon that does it properly, that knows the correct techniques, because there are so many women out there that go to surgeons that don't know how to remove implants, or they're still putting in implants and they're not doing it properly, and silicone is spreading or infection is spreading and the capsules aren't being removed. And I see these women really sick. So I think it's important that we talk about the proper removal of breast implants, and that word gets spread, because I want women to know there is a safety risk if they do not get it taken out properly.
Right. Now, this is a very important point. Now, if someone wants to get their gallbladder out, or they want to get their thyroid removed, or get any like knee replacement, there are plenty of surgeons who can do that. Now, remember, if you group together 1,000 plastic surgeons, majority of them will offer a replacement, because they're truly deep down within in their heart, even though they may have the best website that says world-renowned explant surgeon, which is the majority of the plastic surgeons now in the US that are offering. Deep down within, if you ask their heart and soul, they're not true believers in breast implant illness. And remember, a true plastic surgeon, a genuine plastic surgeon who's truly committed to your health, is the one who's not augmenting. Because I will tell you, look at the problems that I just highlighted. Why would a young lady in her 20s, and she knows in her 30s she's going to potentially have them replaced, and then 40s and 50s and 60s, how many times, if she lives to the averages of 80, let alone the problems of BII, let alone that rare cancer, let alone the contracture, or the acute and chronic pain, or the malposition, and all these other problems that are associated with breast implants. It doesn't make sense to me as a provider that you do harm in order to please the aesthetics. And the goal here is the aesthetics is not worth the pain. And that is the take-home message. Now, someone may choose to get implants, but I want you to know, and if you're listening, by all means, sign up if and only when you do from your mind accept that these problems occur, so that you can get this treatment and care. And my take-home message to you, is it really worth it? I removed a set of implants from a lady from British Columbia 3 months ago or so. A young lady in her 30s, implants done in 2016. I did a Facebook Live. She had both ruptured just 8 years later. Now, don't listen to me. If you listen to her, she had the symptoms of breast implant illness. She was hurting. She was financially not in a position to do the surgery. And majority of the patients, believe it or not, financially are not in a position, because the insurance truly doesn't pay for what is an explant done right, because it is a small fraction of an amount. Insurance does not even have an ICD-10 code for breast implant illness. And going back to the point of breast implant illness, majority of the plastic surgeons don't want to even utter the word breast implant illness, because they know they will deter the many of the patients who are interested in the augmentation. Because believe it or not, this continues to be still the number one, number two surgery that is done by the plastic surgeons. It normally takes 1 hour, 45 minutes to 1 hour to doing a bilateral augmentation. Replacement is even faster. And it takes me on average 4 hours to doing a proper explant, non-ruptured, and average 325 cc implant. And the point here is, for a surgeon to not augment, that validates and authenticates and certifies that the surgeon is genuine, who's board certified. Number two, your surgeon is very active on social media and to talking to the patients about discussing why the surgery and how the surgery needs to be done, what are the goals of the surgery. Very similar to this discussion, to the point where I tell you every plastic surgeon must be doing it. If they are not, that means they are not, I would say, in my mind, I don't have the confidence. Remember, I can only do so many of these in a year, correct? And the bottom line here is that there are millions of ladies, approximately 35 million all over the world. And I will say this to you, there are hundreds and thousands of ladies for sure, and millions who have ruptured implants and who do not even know that they do, because their implants are 8 years old, 10 years old, 15 years old. This lady that came to me from Texas, she has a family member who has implants from the late 70s. And I will tell you, just the fact that they're from that old, that age, they're ruptured. And you hear the patients literally in pain, hurting, grade 4 contracture, grade 3 contracture, ruptured implant known on mammograms and imaging. Remember, they're not lifetime devices, correct? If there are 2.2 million implants being inserted in ladies every 10 years, they should at least theoretically be getting replaced, and they're not. So you can imagine how many ladies are sitting around with ruptured implants, some sooner, some later. There are implants that I've removed that are 25 years old that were intact. And the point I'm trying to make here is, you go to a surgeon who understands breast implant knowledge. Like, for example, in my practice, I exclusively remove implants, be it saline implants, silicone implants, and residual capsules, which is, if you ask me, the worst case scenario. Residual capsules means that the patient already had her explant, but the surgeon was not proficient enough or did not feel comfortable dissecting on top of the rib. And now the patient has to seek me out so that I can do the residual capsule removal so that the patient can bounce back. Now, the very classic example that I would say is that nice lady that you came with from Germany. She already had her explant done along with what is an attempted capsule removal. Then she sought another surgeon out for residual capsules. So that's her second surgery. Ultimately, her third surgery, right? The first one was the augmentation. The second one was an explant plus. And then she came to me, her third surgery for attempted removal. And this is where I went in and I removed how much of that inflamed tissue and capsule, so that now in the latter part of January, we'll hear directly from her. She's going to be 6 months out, and we will hear directly from her how happy she is in regards to her recovery. Now, the bottom line here is the surgeon has to have that mindset, that commitment, that, wholehearted feeling that that capsule must be removed along with the implant in the manner that I've described, so that there is no doubt post-op, if someone has their surgery done and they're sleeping, like my patient from California, she is content, happy, and she has the peace of mind that I removed everything. I have pictures and videos to show I did, and that she's not going to be second guessing me. This is how you have to have that bond, that relationship with your surgeon, so that you are at peace. If any surgeon augments, let's say if I do an augmentation tomorrow, everything that I have said today goes down the drain, because now I nullify. How can I say that the earth is flat and then at the same time say that the earth is round? You have to choose one or the other. And as you will see, there is a group of surgeons out there who have stopped augmenting and who now explant. Now, you still have to be careful. Believe it or not, it was not too long ago that someone approached me and said, well, in my practice, I have a group of plastic surgeons. The one is only dedicated to an explant so that we can sell him, market him better. Because if we say that he augments, we will not be able to market him. And the other people, we cater to the other people, because remember, it's all about money making and profit sharing. And unfortunately, to this day, I tell you with confidence, there are a lot of surgeons and groups who are unfortunately trying to capitalize. Now, I will say this first and foremost, I have nothing to disclose, no financial disclosures. I have no commitment to you, to any other group. I don't pay any face group owners in order to get an asterisk up on the top of the list. Remember, anyone who's making a recommendation to go to a plastic surgeon, or I heard another liaison of a plastic surgeon calling and continuously talking to a prospective patient to lure her in from my Facebook group so that she could end up going to the other surgeons. That is absolutely unprofessional, wrong, unethical, immoral. And I will tell you, the karma is what goes around comes around. And I'll promise you that these surgeons, whoever is doing this, will not have a peace of mind. And this is not fair and right for the patient. Now, if the patient herself says, I want to get an augmentation despite having been told, then that is a different story in itself. We hear repeatedly the many patients who are not forewarned, who are not given the black box warning, the informed consent, so that they do not know what they signed up for.
Wow. Dr. Khan, I have to tell you, when I went to your practice, and I went into the building and the facility and was greeted by your amazing staff members and saw how you treated your patients. I'm telling you, you really touched my heart, because I knew how much you cared. And I can see with your advocacy work how much you care about your patients and what they're going through. And you don't want to see them go through more pain. You don't want to have them come back. I mean, you are the type of doctor and surgeon that you want them to be healthy and go along their merry way and have a great life. And that's what I see from you, and keeping that cost low for women so that you're not paying out these exorbitant referral fees, all of that. It means so much. And I want people to know how much I appreciate you, that you are truly an inspiring person that is dedicated in helping others. So I just want to say thank you. And if anyone wants to reach out to Dr. Khan, I know that he will talk to you. You do like personal consults, right? Little consults. If women have questions, how can they reach out to you, Dr. Khan? Can they just call your office?
So what you can do is, first of all, do your homework. Remember, whenever you even talk to me, you're not making a decision. You're just getting informed consent, which means you're understanding how I'm doing it. And the best way to go about doing it is if you just go to my website and join that private breast implant illness support group page on Facebook by Dr. Khan, and you can send a link, or you go to YouTube. Some people don't like Facebook, maybe half of the listeners and viewers. Then you can go to Instagram, or you can even go to TikTok, and then eventually go to YouTube. I find YouTube, remember, TikTok is more for fun. It's quick, it's rapid, it's high dopamine, meaning you want to move fast. But if you go to YouTube, listen to my patients, listen to the testimonials, listen to my lectures, listen to this, listen to my other podcasts that I've done. After some time, remember, there's only 15, 20 questions that anyone can ask. After that, the questions will tend to repeat themselves. And as you will see, this is a 4-hour surgery, depending on the patients, maybe 5. Look, the 800cc implant that's ruptured tomorrow, it's certainly going to be a challenge. It might take 5, 6, 7 hours, and the bottom line here is whatever length of time it takes in order to doing the surgery correctly, definitively, sincerely, such that the goals of the surgery are met. And let me also mention, it is a whole lot easier. One of the plastic surgeons, reached me and said, well, you're making me look bad. I said, well, don't listen to me, listen to my patients. My patients are happy and benefiting and improving. Then the plastic surgeon literally, said, well, you're trying to capitalize on this. I told her, listen, I used the word stupid to explant and do 6 of these, 7 of these in a week, where I could do 6 augmentations and pretty much make a little bit less on one day between the 2 operating rooms or the 3 operating rooms that I have. And the bottom line here is that between the time commitment, the concentration, the ability, the 4 or 5 hours of explantation, between the tough surgery in order to say, for example, remove that ruptured implant, between the dissection that's done horizontally. And remember, it's a very tedious surgery where I'm operating on a horizontal incision only. There's no vertical up and down incisions. And remember, this is where there's a lot of extensive workup, a lot more inflammation. Putting an implant is very quick and easy, especially a replacement. But this is where this surgery requires a lot of confidence and expertise. And these surgeries are tough. I will tell you, I have discussed with my friends, let's say 10 of them, how I do the surgery. They clearly say, no, 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 I don't want to do that. That's just too much work. And unfortunately, it is. 9 out of 10 plastic surgeons will feel uncomfortable to the point where they have voiced this and said this is too expensive, too involved, too meticulous, and too much unwanted. And I'll tell you, 20 years from now, 10 years from now, I cannot imagine anyone else doing the surgery any different or any better, because remember, it's all about that capsule. And remember, the surgery has a certain finesse, a certain mindset, a certain etiquette. Not everyone can do the surgery. You have to have that right mindset in order to doing the explant right, such that when it is done, you know that no capsule was left behind. It was not cauterized or burnt off. It was physically removed. So in my practice, if you just go and listen to my Facebook Live from today, the fascia of the pectoralis minor, the fascia of the pectoralis major, the inferior aspect in those cases where the implant is below the muscle, the fascia of the serratus anterior muscle, the fascia of the intercostal muscle, and the periosteum and perichondrium, which is the layer of fascia directly on top of the rib, is removed in order to completely, definitively, sincerely remove the capsule plus the implant as one system. And that is the essence of that surgery.
Wow, Dr. Khan, I know that you care about your patients and you care about them getting better, which is why you're doing it the proper way. And I appreciate it. And I want women to get better. I want them to feel better. I want them to, that if they do believe that they have breast implant illness, please feel free to join Dr. Khan's group or message me and I can point you to the right direction to Dr. Khan's group. But thank you so much for being here, for being an advocate for women.
Yeah, and now I just want to mention a couple of things. How do you know your plastic surgeon is the right surgeon? Number one, your surgeon will length of time. So I've heard this from many other patients who have come to me, especially with the residual capsules. How long was your surgery? They said an hour, hour and a half, 2 hours. I'll tell you, this surgery cannot be done in 2 hours. This is where the care and finesse, even when the implant is above, takes almost on average plus minus 4 hours. So the length of time of the surgery. Number two, the incision length. I see some surgeons do an incision that's 2, 3, 4, 5 centimeters. You cannot remove a 500 cc implant. 8, 9, 10, 11 centimeters is how long it needs to be, and an incision that's horizontal only, that's going to hide in the crease. Number three, you have to return the implants to the patient. So my first patient today, believe it or not, she told me she had saline implants and she had silicone, what is I removed from her chest. And so she basically, it is important for your surgeon to return the implants to the patient. Now, I've heard this from some surgeons that, oh, it's a HIPAA violation. Absolutely not. HIPAA is, if I take one patient's name, information, date of birth, and share their file folder with someone that they did not authorize, like a friend or a family member, or put it on social media, it is not a HIPAA violation to return. Remember, these were inside the patient. Don't tell me they cannot hold it. And I put it in a special bag so that they can still at least see through it. If there was inside on their body, they certainly can touch it, correct? But they still, I give it in a biohazard bag, and it is in a container. So number three, the implants are returned to the patient. Number four, I give high definition pictures, videos to the patient of the chest wall showing complete removal of that capsule plus inflamed tissue. And then also, equally importantly, cutting open of that capsule so that you see that what was cut was completely, that capsule was removed. So I find a lot of surgeons, unfortunately, do not want to give videos and pictures to the patients. I'll tell you, it's not a HIPAA violation. We do it all the time. Look at, you get a colonoscopy, they will give you the inside of the colon to show the appendix and what not else was removed, right? It is standard operating protocol. It is important for the patients to ask, demand, and mandate that they get high definition pictures and videos of the chest wall showing complete removal of that capsule to see that periosteum, perichondrium, the fascia of the intercostal muscles, serratus, and all that removed completely. And there is nothing wrong in that. You want to see that what was removed was indeed what was removed. And number 5, you want to make sure that the capsule is sent to pathology, because that in itself is clear evidence. I saw a patient with residual capsule, and the capsule size was 2.3 by 5 by 4 centimeters, and she had a 650 cc implant. Her capsule should at least be 12.5 centimeter in length, because that's the size of the capsule. And the point here is, they do not want to send this off because that will be the proof what was removed, and they cauterized. It is improper, wrong, and incomplete to cauterize or burn the capsule. You have to physically remove it, and this is the challenge of the surgery. There was a forum or symposium 4 weeks ago where a lot of plastic surgeons got together, and one of the plastic surgeons asked, well, do you remove the capsule all the time? Of course, you have to. That's the bond you have with the patient, right? Yes, it is tough. It is hard. I wish I could do it in an hour and be done with the day. No, it has to be done completely, sincerely, definitively. There was another surgeon who, as you saw, and every surgeon has a different mindset. With all due respect to the surgeons, and I salute those surgeons because they were talking about the patient's best interest. And the bottom line here is number 6, which is the most important. The surgeon must be actively talking, not like, oh, he's got a nice fancy office with the marble on the ground, or he's the professor of this or the professor of that, or he was the past president of this society or that. That is all, good on paper, but in reality, if someone can do like a artificial lip reconstruction, for example, or doesn't mean that they're going to be the world-class explant surgeon. So you have to seek the surgeon out. You have to be able to see and listen and talk to their patients, see the patients. If you can, Cecily, or anyone else, just come up with a very objective, non-biased, very serious group where you allocate, this is surgeon A from this date, these are her pictures of the chest wall, this is how long his surgery is, these are his pictures. You have to have pictures, you have to have videos, and these are the patient testimonials about how fast the surgeries are done on average. This will be a very good indicator to the plastic surgeons, to the prospective patients, as to how the surgeon is and how he does the surgery. Because remember, as I talk today, as I did my surgeries today, Facebook Live, as my patients talk, and I happily, willfully give them the videos and pictures, each one of them is a testimonial that I continue to do the surgery in the manner that I described. And this is how every plastic surgeon, be it Europe, in England, be it in Italy and France, South America, Brazil, wherever. Remember, there are a lot of patients in a lot of countries, the United States being the most populated country with patients with implants. This is where you have a check and balance, not like a Facebook group owner who gets donations and now promotes, or basically a plastic surgeon who came up with a top 10 list and he put himself on and says, I'm the king of pop. No, that's not how it works. It works where you have an objective, authentic, serious, very defined way of doing it, and that you stand by it with honor and integrity. I salute the doc from Cleveland, Dr. Feng, who said, if you do an explant and you write down end block and you have done just 50% total capsulectomy, or partial capsulectomy, if you will, the word total means 100%. Owe up, be a person of integrity, and say you just did that, because you know what? That is the right thing to do professionally. If you are not able to, tell the patients you cannot. Just don't get another patient and say, well, you will try to. That's not good enough, because now the patient will seek another surgeon out so that he or she needs to feel better and will remove that total capsule. Now, I get this question asked a lot. Really, does the whole capsule need to be removed? Guess what, Cecily? The proof is in the pudding. Again, not my words. These are the words of the pathologist, and I'm going to read right here. Right breast implant capsule, histiocytic granuloma reaction with associated non-polarizable material consistent with silicone mastitis, which means mastitis, mast means breast tissue, itis means inflammation. So silicone-induced inflammation of the breast tissue, non-polarizable material is foreign material. So this is where the patient had this, and remember, CD30 stain is performed and is non-contributory. Look, why should the capsule be removed? Because you don't want to leave those particles behind. Not every patient has this, but this is, remember, look at this other pathology report. Refractile material, foreign material associated with multinucleated giant cell reaction compatible with reaction to foreign materials. This is within the capsule. This is why the capsule needs to be removed. That one patient on Real Self said, well, the en bloc is not required on everyone. Technically, theoretically true, but you don't want to be that patient where the patient had a ruptured implant and now the silicone spill into the chest and say, well, guess what? We should have done it. No, too late. What do they say? The milk has already been spilled. You have to do it right with the right mindset. The CD30 does not highlight atypical cells. Let me do another few more, just to show that this is the pathology final report. Refractile foreign material associated with multinucleated giant cell reaction compatible with reaction to foreign materials. And this is the implant particles. And so let me do a couple more. You will see this is residual capsule, residual. So this patient already had the explant. I removed the residual capsule. So this patient, as you will see, this patient actually came to me from England. Exuberant foreign body giant cell reaction, granuloma inflammation consistent with silicone mastitis. You don't want to leave this behind because the patient is going to continue to hurt. Not in everyone, but when I'm removing, I cannot tell by my eyes that it is good or bad. That's why the pathologist is key in order to do the stain.
Yeah, I had an infection, and if I hadn't have done a pathology report that took the infection part of it, right? Because there's different, you've got the cancer part, you've got the microbiology part. If I wouldn't have had that, I wouldn't have known that I had this serious infection in my capsules. So I just appreciate this very valuable information. Women need to understand there are steps.
Right. So look at this one. Refractile foreign material is identified, which may represent breast implant particles. There is no evidence of cancer or lymphoma. And again, path after path after path talks about this. And this is where, look at this case, where the patient had what is a fibroadenoma, which is the most common benign tumor removed from the left breast capsular chest mass. So if I find anything abnormal, I'm going to remove it because I cannot tell what it is. And this is where I rely on the pathologist to tell me what it is and what it is not. Now, I will end with this on my end. In my practice, in my technique, and as you have heard me say this many times in the many Facebook Lives that I have done, number one, this is how I do it. Number one, no need for the unnecessary lift. Now, a majority of the patients don't need it. Some patients do. Now, this is not the time to be doing a lift when you have a ruptured implant or you have a lot of inflammation. Remember, the lift is done at the surface of the skin, the nipple areola. The whole explant is done at the basement level, meaning the ribs. These are two separate surgeries. You do not want to be doing two surgeries and then being on the OR table for a surgery that you may not need. Surgery OR table time that may be 6, 7, 8 hours. Wound dehiscence, complications, contracture, infection that someone may have. You don't want to be doing big fancy surgery that may not even potentially be required. They may lead to skin necrosis, nipple necrosis. So no lift, majority of the cases. Remember, I have done patients with who needed a lift. No need for the unnecessary drain. As you will see, I have not placed a drain in well over 5 years. Number 3, I send the capsule off to pathology, any abnormal masses to pathology to make sure it's not cancer. Number 4, I send cultures for bacteria, aerobic, anaerobic, and fungal to the microbiology lab. Number 5, I return the implants to the patient. Number 6, twilight deep sedation, which is propofol, fentanyl, Versed. Number 7, I basically the high definition pictures, videos, showing complete removal of the capsule off of the rib and cutting open of that capsule and the implant, as you have seen many times. And number 8, all patients, regardless of age, comorbidities, get the same surgery. Now, if they have problems, comorbidities, like a history of a heart attack and stents, I take them to the hospital. But if they meet criteria and their ASA classification is good, they're young and healthy, I certainly do it at the surgery center. So remember, there is a certain finesse and etiquette. I'm very much deeply involved with all patients. I know them all very well. Remember, there is a lot of hurt sometimes that the patients come in with, a patient with 800 cc ruptured implant radiation. Correct. There's a lot of already damage. Someone with a poor A1C, I'm going to say fix the hemoglobin A1C before we do the surgery. So, because I want my patients to be optimized. Here's a patient that came in with a ruptured implant done very poorly by a surgeon who was not board certified, done overseas, and her ruptured implant made it all the way to the skin. Now, this is very analogous to someone came in with a bad dog bite to the face. And the patient said, well, the scar's so bad. I said, well, did you see how bad the dog bite was, right? And the bottom line is we're dealing with badness. Remember, this tissue is not healthy. It's inflamed. You see this reaction. And when the surgery is done, we want to take into account that this tissue will take some time to heal. And this is where the goal here is to remove all the badness and at the same time be focused on the aesthetics as well.
Wow. Thank you, Dr. Khan. This is such valuable information. And thank you for your time and what you do and for making the efforts to do it right the first time.
Right. Do it right the first time. The biggest mistake, if you ask me, or the worst case scenario, is a patient goes to a doc. The doc is saying, of course I can do it. It's a piece of cake. And the next thing you know, the doctor goes in and says, well, it was a lot thinner capsule, so I left it behind, or I cauterized it, or I did it, and documents it's an end block. I have seen so many videos where the patients post and the doctors post where there are holes within the capsule and the surgeon uses the word end block, which is the wrong term. This is suggestive of a partial capsulectomy, which is the wrong answer. Remember, the word end block is not, it's truly meant for oncologic purposes. Like someone has a cancer of the pancreas and you remove it, end block meaning the good tissue around. Remember, the whole goal is to removing it such that there's no spillage and all inflamed tissue, capsule or tissue implant is removed so that no bad tissue is left behind and only good, healthy, viable tissue remains behind. Any questions do you have for me or listeners? Anyone else if you can think of, please ask me.
Well, I think that you've actually answered the questions that people had. So I just appreciate all the information. And please, those that are listening, spread the word. Please, if you have somebody, a loved one or yourself that have breast implants and you're sick, you don't understand why you're sick, please get a hold of, you can contact me. You can join Dr. Khan's group. I'll make sure that all the information is placed in the comments. Go to his YouTube channel, do your research, because I mean, this illness is very comprehensive. It's very difficult to diagnose and there's no diagnostic code. So being able to connect with the right people, the right doctors, the right surgeons is very important in order for your healing process. So thank you, Dr. Khan, for your time and for all that you do for others.
No, thank you. My pleasure. I have to use the word evil. This is a very evil disease because it tricks and deceives a lot of patients, a lot of plastic surgeons, a lot of significant others, a lot of primary care doctors, emergency room doctors, and like I said, the patients themselves. And if you do your research and you approach this with an open mind, and I say this to the world, whoever is listening, don't listen to me, listen to the patients, because the patients are speaking and talking, and they are expressing their anger, their frustration, and their hurt. They are not making this up. They're not making these symptoms up. They're not saying, well, these symptoms that are highlighted need to be downplayed. They have nothing to gain except for their good health. And if you just listen to the patients, you will have clear and very evident proof, just like in the pathology reports, just like in the ban that occurred in 92, that the implants are not worth it. They ultimately hurt the body, some patients sooner, some patients later. Remember, they're not lifetime devices. And you want to take care of a small fire versus a big fire. You want to be on top of things. You want to be well-read. Just listen to the patients and listen to your heart and listen to your mind. And I will promise you, you'll only reach that conclusion that they're not worth it.
Perfect advice. Thank you so much, Dr. Khan. And thank you for all of those that are watching. Thank you for being here. Just know you're not alone, that you're here. You have support. Please reach out to us, and wishing everyone a wonderful evening.
No, thank you very much. Take care. Happy
Thanks.
holidays to everyone. Bye-bye.
Happy holidays.